It is a very good afternoon to everybody tuned in to the Real Talk Show, joining us live on our Facebook page, the youth platform. My name is George Mukwita, and welcome to the Real Talk Show, the show where we tackle tough topics that matter to young people in Zambia today and in the region as well. We are diving into a really important subject today that affects many lives in Zambia and of course across the southern region. Today we are talking about understanding abortion laws in Zambia. It's a topic often misunderstood, and for many young people especially, having the accurate information is very important for them. It's key to making informed decisions. Remember, today's episode is brought to you by the Amplified Change and the Be Safe campaign under the Youth Community Advocacy Project, YCAP. We know there's a lot of confusion and a lot of myth out there. People are sharing information, and most of it is really, really wrong, and it's tragic. And this can lead to dangerous choices like unsafe abortions. That's why we have brought you experts on today's show to break down exactly what the law says when it comes to abortion. You should know your rights and where you can access legal and safe services. Our goal is to empower you with the knowledge you need to know to protect your health as well as your future. So on the show today, we brought you experts as mentioned. We have Dr. Mwila, a gynecologist at Challenge Level 1 Hospital in Lusaka. We also have Miranda Ziba, who's Senior Programs Officer at the Youth Platform, as well as Mr. Enoch Intoka joining us, who's Head of Programs at the Youth Platform. And not forgetting my co-presenter on the sign language side of things, Amon Chikada. Welcome to the show, guys.
Thank you so much.
Thank you so much, George. Yes.
Thank you very much.
Okay, so
Thank
I'd
you,
like
George.
to...
We wanted to be here.
Awesome. So I'd like to begin with Doc. If you could briefly just introduce yourself, just give us a little bit about information about yourself before we get into today's topic.
So Dr. Mwila Richard is my name. I'm obstetrician gynecologist. I work for Chirenge Festival Hospital as a medical superintendent, but I'm also in reproductive health services because I coordinate the province in terms of obstetrics and gynecology issues. And I've worked with a number of the NGOs in terms of trying to discuss the issues around abortion and train people in abortion as well as the contraceptive services. So I'm a national trainer for those things. I think I'll end here.
Awesome. Okay, so to begin with, as we get to the topic, can you break down the fundamental principles of Zambia's abortion law, specifically the Termination of Pregnancy TOP Act of 1972, and tell us what it actually says about when an abortion is considered legal?
Okay, thank you so much, Mr. Moderator. So I think since we are communicating to the public, the starting point is the termination of pregnancy is illegal in our republic, and it should just be conducted in a certain manner where, as we proceed, we'll talk about the consequences if it's not done in a certain manner. So we have the Republican Constitution, which guides us as to where, when we can conduct a termination of pregnancy. And then we have the Termination of Pregnancy Act, as the presenter put it, which was in 1972, and it was revised later on. So what this means is, in our country, the termination of pregnancy, as long as it is done in an environment which is allowed by the Minister of Health, it is very legal. we have also these other provisions which help us to conduct this termination of pregnancy. We have a body which guides the health professionals, which is called Health Profession Council. So these will regulate people who are providing that service, and they will see to it that you follow that and it is allowed. But the good part with Zambia also, because Zambia is not an island, we have subscribed to what is called the gender equity and equality. So for this, a woman has been given a right to decide what they want to do about their reproductive life. I think we'll go a bit of it into details as we progress. Thank you.
Thank you so much. My follow-up questions to that is number one. So, termination of pregnancy in Zambia is legal, isn't it? Yes.
Yes. Termination.
Could you? Thank you, Doc. Could you outline specific conditions under which a pregnancy can be legally terminated?
So George, allow me to just add on before the doc can come up with the conditions. Just to emphasize that, just like the doc said that it's the termination of pregnancy in Zambia is legal, it is also important for the members of the committee or the followers to understand that the legality of the termination of pregnancy in Zambia is not just deliberate, but it's meant to safeguard the health and the life of a woman. I think that is cardinal for the committee also to know. But also, as we delve into the conditions, I think the keyword condition is very important for the members of the committee to know, because it's not like a woman will just walk into a facility and just demand that termination of pregnancy happens. But there are certain parameters, there are certain conditions that should be met to warrant that termination to happen. So, Doc, you can go on.
Okay, so I said there are certain conditions which are required, and maybe I can also mention that by law, the Constitution, Termination of Pregnancy Act, you cannot deprive the unborn with life. That should be kept in mind. So even the unborn has a right to life. But the law has guided in a way that you can deprive the unborn in certain circumstances. So the most important is the mother who is living. So if that unborn child who is in the womb will affect the health of the mother who is existing, the law allows you to end that pregnancy. And it should be before a certain age where the child cannot survive outside the mother's womb. And for the purpose of this discussion, anything below 7 months, it cannot survive in the Zambian setup. So the law allows you to end the pregnancy before 28 weeks, which is 7 months, and you'll be covered by the law. But it's not just the health, because health is so wide, but it's also the mental, the mind of the existing mother, not necessarily to go to the baby, the mother who is existing. Has it affected the mental health? Has it caused the stress? Then you can end that pregnancy and it's within the law. So anyone can walk into the health facility. There is no fear attached to it, and you can access that service. And the law meant to protect people who are existing. So it went on to say, in the event that the existing children will be affected, then that pregnancy will be ended. What am I trying to say? Let's say a woman has 10 children and they get pregnant and they were having a loaf of bread. And if they have another child, then they will not manage to feed. So it will affect the existing children, maybe at school, the food. So that pregnancy, it means it falls into what the law allows for it to be ended because you are concerned about the existing children. The other part is, which is the one which we consider more like last, is if the child who is not born, they have the condition in such a way that maybe they have no head, maybe they have no legs, and we call them congenital anomalies. And if they were born, they can survive outside on earth. And you find out before that age I spoke about, which is 7 months, and you see that the baby will not survive in the event that it is born, then we have the right to end the pregnancy. It's within the law.
Thank you, Doc. So for a young person trying to access legal and safe abortion in Zambia, what is the legal process that they must follow to have access to safe and legal abortion?
So the legal process, of course, you have to go to a registered health institution, and this should be approved by the Minister of Health, as it would be a place where the pregnancy can be ended. And there should be a medical practitioner there who should provide a service, and the facility is going to facilitate, as we know, that you need 3 doctors to sign to it. And if they sign the form and the abortion is can proceed. But there are certain circumstances where you just need one medical officer to sign that and you proceed as it were. So for the community purpose, what should happen is when you need to end the pregnancy, you go to a health institution, a hospital, a clinic. You'll be talked to by, you'll be seen by health practitioners. Those could be nurse, could be doctor, could be clinic officer. Then they are going to explain. You will not just reach and they say, we're ending this pregnancy. You reach, you'll be talked to, and they will explain, and you also give the reasons as to why that pregnancy has ended. And then yourself, you are going to make a decision as to whether you should proceed or you should end that pregnancy. Then they are going to tell you how we do it and what will follow after the interventions which we're going to have.
Okay, is it free of charge, or is there any charge attached to the termination of pregnancy or ending a pregnancy for the young people?
All health services in our facilities, there are some which probably, if someone was asked to do a scan, they may pay for it. But in terms of the provision of the service, the way we see someone with malaria is the same way we see someone who wants to terminate the pregnancy. So there is no charge. I may not know in the private sector, but for government hospitals, all of us have to attend to a client, just like the way we attend for family planning, just like the way we attend for a person who has malaria. And if someone has any other problem, it's the same way. So there's no charge attached to it. But in the event that probably they asked to do a scan, and I think the minister has given a directive to say anyone who's pregnant, the scan in all government hospitals you don't attach a fee. So meaning, all in all, if a client wants to terminate a pregnancy, there is no charge involved in a government hospital.
Thank you so much, Doc, for that wonderful information. I'm sure our viewers really, really following our show today. Remember that today's show is brought to you by Amplify Change and the Be Safe campaign under the Youth Community Advocacy Project. Our topic of discussion today is understanding abortion laws in Zambia. So please, in the comment section, send through your questions and your contributions on today's topic. We are also joined by Miranda Ziba, who is a project officer for the Youth Community Advocacy Project. Miranda, welcome to the show. And can you please tell us first what your work is at the Youth Platform, and tell us a bit more about the Community Advocacy Project and what is the YCAP's main goal?
Thank you very much, George, for this opportunity. So my name is Miranda, just like George has mentioned, Miranda Ziba. I am the Senior Programs Officer here at the Youth Platform, and I implement different projects, and I provide guidance to other project officers to see how their work is running, and I provide support to their projects. So about the Youth Community Advocacy Project, this project is it's funded by Amplify Change, and we are addressing the causes of unsafe abortion on this project. So I'm really glad that Dr. Mila is here, and he's here to provide us with this information. And so this project is actually providing this information to adolescent girls and young women, and we are reaching out to higher learning institutions. So the main goal of the project is actually to address the causes of unsafe abortion by ensuring that we address the systematic inequalities and the obstacles that come with accessing contraceptives and also accessing comprehensive abortion care. So on the project, we are not only focusing on comprehensive abortion care, but we are also ensuring that young people are aware of the availability of contraceptives, they access contraceptives, and they are able to make informed choices before they get to the option of wanting to go and undergo an abortion. So we are working with these higher learning institutions and ensuring that young people are well informed, and we are also ensuring that we provide the service to them. So the service we are providing to them is providing them with contraceptives. We go into the institution and we provide the contraceptives to those young people that want to access the contraceptives. By so doing, we are preventing unintended pregnancies so that the young people cannot end up just depending or relying on abortions. So the core message is on contraceptives, and we are also providing them with the legal provisions on abortion care. So we are providing them with these legal provisions because we do not want them to be found wanting by the law. We do not want them to continue doing the unsafe abortions. We have this trend in institutions that every institution you go to, you will at least find one or two people that have conducted an unsafe abortion. Sometimes we find fetuses in the toilets and things like that. So we want to avoid that by ensuring that young people are aware of the legal provisions. They know what the consequences of doing an illegal abortion are, and they also know where they can access legal abortions. So this is why we are providing this information to the young people, and this is really what our project is aiming to address. Yeah.
Sounds like important work you have right there, Miranda. Could you tell our audience where YCAP is implementing its projects and what are some of the main activities that you talked about? We heard you go to young people. Are those the only activities that you do, or are there any other activities that you haven't mentioned that are on the project?
All right, that's great. That's a great question. So this YCAP project is being implemented in 3 districts. So we are implementing the project in Kasama. We are also implementing it in Kitwe and Kabwe districts. So we are implementing this in higher learning institutions. We have different activities that we are implementing in those institutions, and we are also not leaving out our communities. So we are conducting interactive sessions with students within the institutions where we are providing them with an opportunity to interact with healthcare providers and get adequate information on comprehensive abortion care, for example, and also on contraceptives. So these interactive sessions sometimes are done through question and answer sessions where the young people ask the questions to the healthcare providers and they respond to those questions. And sometimes we hold them in form of panel discussions where the young people are able to discuss and bring out the relevant issues that they would like to bring out to the healthcare providers, ask their questions and contribute, provide recommendations. Apart from the interactive sessions, we also hold weekend clinics on the project. These weekend clinics are provided to, we provide different services to students within their institution. So we take the services closer, we move the clinic from the health facility and we take into their school so that they are able to access the different services I spoke to. These services include contraceptives, access to different methods of contraceptives. And we also provide different services such as STI screening. As you may be aware, STIs are very rampant in higher learning institutions, and anywhere you're going to find anywhere you're going to find young people. So we ensure that we also conduct STI screening because most young people actually end up thinking they have a fungal infection, or rather they keep treating the STI as a fungal infection when in the actual sense it is an STI. So that STI will keep recurring and without them being able to know that they have an STI. So we are conducting STI screening within the schools, ensuring that they are testing for STIs. And they're also accessing the contraceptives like I mentioned. So we have a lot of other activities such as interface meetings where we allow recipients of care to interact with healthcare providers and provide them with their issues and come up with ways on how they can resolve those challenges they're experiencing. With the aim of improving access to services for adolescents and young people. We also have dialogue meetings where we advocate for the improved policies and also advocate for improved services with different stakeholders within each of these districts where we're implementing this project. So these are among the activities that I would like to share, but also not to forget that we also have community-led monitoring where we are collecting data from adolescents and young people. So CLM is being implemented in all the districts. We are gathering this data, and the evidence that we have from this data that we are gathering is used for meetings such as the dialogue meetings, where we present this to our different stakeholders to see what, for example, would be the preferred options for young people in terms of contraceptives and different information that we get from the young people. So let me not say so much. I think this is what I'm able to share among the activities.
Lovely. I'm excited.
Yes.
It's lovely, lovely. So maybe before Enoch you come in, maybe one last question, Mimi, is we've heard about the Be Safe campaign. Be Safe campaign. Can you explain more about the Be Safe campaign and what is the campaign about and what it hopes to achieve in not so many ways, maybe?
All right, thank you, and thanks for that question. So the Be Safe campaign is one of the activities we are implementing on this project. It's a social media-based campaign, and we have aligned it to the goal of the project. So this is still trying to achieve the main goal of the project, but this time around, we are implementing different activities online. So this is one of the activities that we are implementing. The Real Talk Show is one of the activities that are on the Be Safe campaign. We are implementing this on Facebook, Instagram, and we are also showing on YouTube. So we have different activities going on. We have infographics where we are going to be providing different information. We are going to be providing facts about contraceptives and the topics that we are speaking about today. We are having different interactions with different groups on WhatsApp groups and AYP on the streets as well, and we'll be able to share what the young people are saying on the streets. We are going to be having different polls, and yeah, just to say that the main aim of this campaign also is to ensure that we link young people through social media. We link them to different healthcare facilities so that they are able to access services. Yeah, so that's what I can say about the campaign.
Thank you so much. Enoch, take it away.
Yeah, so very interesting stuff coming up. And I think for a project such as what Miranda is implementing through the youth platform, I'm meant to believe that there are basically key challenges that are compounded by the fact that, look, Zambian society is high on things like traditional values and Christian values that may not permit for certain, interaction within the community to begin to allow some of these services to take place. So I think in the discussion, for me, I would love George to hear how the project is also addressing some of those particular challenges to ensure that the beneficiaries of some of these particular services, interact with the services without much hindrance. But also that can be spoken of from Dr. Mila. So want to hear from his side what has been his experience given the high values for Christian and traditional values. What are some of the challenges and how has he navigated? But I know that is something that we can discuss along the way. But Dr. Miller, for me, I want to find out. We've been talking about legal abortion, legal this, illegal. I want to believe that the penal code at some point spells out some of the punitive measures and some of the forbidden stuff that can amount to illegal abortions. To what extent does the penal code speak to some of the legalities around termination of pregnancy?
Yes, thank you so much. I think we touched a bit on that because we are looking at where you are doing the termination of pregnancy from and who is doing it. So in the event that you go and a Dr. Mwila or who is your grandfather, for instance, gives you medicine in the house, and you end to have to be known by the state, the government.
George, are you able to hear Dr. Mwila?
No, he's frozen.
That you ended the pregnancy in that manner. Then a Dr. Mwila, in the event of you procure a drug and your intention is that you end the pregnancy, it means that you are going to be jailed for 7 years. So I think what I can emphasize is for the purpose of this meeting, it's for Miranda to have advocates and inform the community of to tell them that the government provides such a service and the law allows, the drugs are there, the health workers are there to assist, because the consequences are quite bad. We have had a number of people who've been jailed, and in the event that it is more than what I said, 7 months, it means you have ended a life if you do it outside the provisions of the law, and you are supposed to be jailed for life. So those are some of the things which the community should know, so that, but they might not know those, or they might not be there might not be things which we should emphasize on for them to know. But I think what they should know is the law is there for the health workers to end the pregnancy in a Minister of Health designated place and where there are trained health workers and it's safe to end. I think for me, that's what I take as the most cardinal information which they need to know. Because once they don't know, then they'll end up going to other places and do other things, and then the law will visit them, which it means myself and maybe the rest of our team, we have failed because we never gave out the information to the community.
All right, thank you so much for that elaborate explanation. Just a matter of follow-up. Does the law also prohibit for somebody to assist another person to procure abortion services or assist someone to abort? And if the law doesn't permit, what are some of the actions that can be said to have assisted someone? Because the community may not know to say doing ABCD is actually assisting someone to abort, and it's illegal, and they can actually go to jail for it. What are some of those particular actions if the law doesn't permit to assist someone to procure abortion?
So the law does not provide for someone to procure termination of the pregnancy, to assist someone to procure the termination of pregnancy outside what we had discussed, that it should be in the facility where it's, and it should be within a certain age of the pregnancy, and it should should fall under those provisions which we spoke about. So in the event that Enoch assisted someone to either procure drugs, it can be drugs which is from the pharmacy, which the hospital also uses, or it could be just to use any noxious things from the community. It means even Enoch is liable and you'll be jailed, not for less than 7 years.
Wow.
So people should know that it's not only the client who's seeking termination of pregnancy from a place where it's legally allowed. So if you seek it from a Dr. Mwila in his home, a Dr. Mwila is liable for jail sentence of not less than 7 years, because his house, even if he is trained to end the pregnancy, his house is not, by the means of health, you cannot conduct such an activity in his house.
Last question from me before George takes it up. Is there any consent needed for a person below 16 years, consent from guardian or parents before they access abortion services from a legally recognized institution?
Yes, so maybe I mentioned it in the beginning. There are two ways of ending the pregnancy. You can use the medicine, or you can go to theater, which is operating where it's not an operation which is complicated, but for anything which you need to operate, you need someone, or even to end the pregnancy, you need someone to sign a consent. But what it is in the event that there is a minor and the guardian probably is not aware, or the guardian does not want what the minor wants, because the person who is in question, I think I spoke about gender equity and equality. The woman has to decide what they want to happen to their body, either to have a pregnancy, not to have a pregnancy, how many children they want. So it can be the guardian when the minor comes to our institution and they, for instance, they don't want the guardian to know, the hospital, in the interest of the minor, has the right to sign a consent in good faith to provide that service. Because if the institution does not provide, the government institution does not provide that service, the minor is likely to go to places where it will be unsafe, and then you start having complications like they will die, or they may have complications in future, which we are trying to avoid. And I think with the partners, the government has made a headway, and we have moved quite a lot in terms of this area.
So
Thank you so much. Yeah, George, you have a follow-up?
Yes, thank you. Doc, so I wanted to find out, has there been a situation, maybe you've encountered in your line of work, where a mother or parents actually bring a young person to a health facility, maybe even to you at the health facility, to say, would like to procure tax services? Has there been a situation where a parent has actually brought their daughters in this case? And how often does that happen?
It happens so often, and I may not have the statistics on the fingertips, but on the personal level, I've attended to so many adolescents. I think those who are being abused by even their own guardians, and those who, of course, the parents know that if the pregnancy was to continue, probably to affect the woman, and it will disturb their life, and they come. So we have a lot of parents. That's why I was talking about publicity. They just have to know. I think I've said in many meetings, like I had a 15-year-old male who impregnated a 9-year-old girl, and he was from the same house. So it's the parents who brought the child to the hospital, and we had to cancel. And after canceling, we ended up that we needed to end that pregnancy. So those who are aware, they bring these adolescents to our facilities. So meaning, in Miranda, you have a lot of work to do, because the community has to know what the government can provide. Because in the government, we might not have a public health intervention which we can manage, because of course, all of us know that the capacity might not allow. So with the help of you, the partners, if you can do advocacy and community sensitization, then I think it will go a long way.
Thank you. So Miranda, I'm riding on what Dr. Mwela just said. We're discussing a very sensitive topic, abortion law in Zambia. How easy is it to have such discussions in the community where you are implementing your projects? And how is it received by the community?
Thank you. So in terms of discussing these issues with the community, as you may all be aware, this is a very sensitive topic. But we are using an approach that ensures that we put forward contraceptives and speak to abortion care as an option, as a last option, in the event that contraceptives fail, or you fail to access the contraceptives and you find yourself in a situation where you need to conduct or to terminate a pregnancy. But just to say, we are working closely with the Ministry of Health, and they have been of great help on this project. And they have been able to assist us through the community to do the community sensitizations Like I mentioned, we have weekend clinics on the project and different interactive sessions. Through the healthcare providers, we have been able to reach more people than we expected on the project, for example. We have been able to go into the communities with the help of the neighborhood health committees who have the community at their fingertips, and they're able to guide us into the community where we meet different people within the community and have discussions on the same. The other good part is that we are providing legal information. We are providing them on information on the legal provisions, and we are ensuring that the community is aware of this. And so far, the communities we have gone to have really appreciated this information in the sense that we are not necessarily going into the community to encourage people to access to terminate pregnancies, for example, but we are taking a message on the law, what the law says about abortion care. And so a lot of young people have been able to reach out, and even the parents, like Dr. Muller has mentioned, we have some parents that have reached out to us and saying they have a situation which has led them to want to terminate a pregnancy for an adolescent or a young person, and they would like to follow the legal way. They do not want to provide the service in a wrong way. We have also been able to get in touch with some of the people that were providing this service illegally. And after providing them with information on the law, on what the law says, they have now been able to refer people to health facilities, because now we are linking them to health practitioners. We are also linking them to providers of termination of pregnancy. And these people are now being able to access services legally, because now we have given them the information and they're able to follow what the law says. So in as much as it is a very sensitive topic, we have managed to penetrate the communities because of the nature of the information we are providing. And through the help of community leaders, we are also working with different community leaders in a setup where we have a village. We are working with the village headmen, ensuring that they are well informed and they assist us to get through to their communities. So we have had a number of mixed feelings about certain community members, also talking about religious leaders, for example. But to say that the intervention of community leaders has really helped, because in some setups, we've even been able to reach out to churches. So I think the way the information is being packaged is what is really helping. And we have experts like Dr. Muller and other healthcare providers coming in to help.
Awesome. So I would like to, as we wrap up the show now, Miranda, I would like you to give us your final thought on today's topic, and also what is the main message. Of course, you've already mentioned or highlighted on some of the main messages of the YCAP as well as the Be Safe campaign. But as we wrap up today, your final thoughts on today's show and what young people need to know, especially with regards to the laws and where to access services.
Thank you very much. I think we have really emphasized on the show the importance of young people accessing services according to what the law stipulates. So it is very important for young people to know that safe abortion is legal once you access it in the designated health facilities, and you access it under the law according to what the law says. So as young people, we just encourage young people to not fear going to health facilities. We could also reach out through the youth-friendly spaces, and they will lead us to the right people within the facilities that are able to provide us with the service. So as young people, I would really encourage young people to read and also just follow the right procedures when you want to access different services. Yeah.
Thank you. Enoch, I don't know if you want to ask a question, or maybe I can ask you to give us your final thought on today's topic of discussion.
Yeah, so I think my final thoughts I've learned, and my three takeaways from today's discussion is that first of all, abortion in Zambia is legal as far as the 1972 Act is concerned, and also the amendments that have been made over time. But also, what is key for members of the community and our followers to know is that I think this is one of the rights that must be exercised. However, there is a channel and a legal process through which this particular right can be exercised. And also, Dr. Mira mentioned that these services, if followed the right channel, are safe and also free of charge from the public and gazetted facilities. So I think what remains to be done is to ensure that the members of the community are brought to speed or are made aware of the legal provisions for procurement and the accessibility of abortion services. So his appeal to the stakeholders is timely, that we should all come together and ensure that where possible and where permissible, we ensure that the members of the community have this particular information. I think it's been a wonderful interaction for me and a lot of takeaways that can take me the whole day to explain. Thank you so much, George, for allowing me a platform to be part of you.
All right. No, you're welcome. And thank you for taking time to be part of this platform. And of course, as you said, partners coming together is a very important thing. For those who are listening to this broadcast, it's important that you also share it on your platform so that young people can be able to access the information that has been shared here. And of course, as TYP, we're already making those steps. We've been doing this, and we're already here to ensure that the access to information that the young people need is available on our platform. The only other thing that could, of course, come through is the issue of how do young people share this information and make it as viral as possible, because it is important for them. So it cannot be a concern to you today, but it could be somebody else who's looking for that service. I'll turn to you, Dr. Miller, for your final thoughts. And before that, I'd like to thank you for making time to be here on today's show. And finally, in your expert opinion, what is the core purpose of the Zambia's abortion law in relation to public health and the well-being of young people? And how does understanding the law help them make safe and legal choices? As you respond to this one, you can also give an overview of your thought, or maybe something that may not have been brought out.
The law is there to safeguard a life of a woman. So life and health has to be protected. That's why the law is there. So we love that we even have now Department of Public Health, as the president has put it, which has been enhanced by employing health workers who are specifically dealing in public health intervention, meaning they are going to the community to do the intervention. The most important part of the law is to protect the woman who is carrying the pregnancy. And if the woman knows that which is the termination of the pregnancy is legally allowed, then I think we are going to reduce on the number of women who will be dying from ending the pregnancy in a way which is not allowed. I think that's the most important thing which I said Miranda should take, so that the community is very much aware and they can come to our facilities for them to access.
So once again, Doc, thank you so much, Miranda Ziva, as well as Mr. Enoch Intoka. Thank you so much for tuning in to today's this week's episode. Today's episode of the Real Talk Show. Our guests were here and to help us understand the abortion laws in Zambia. This conversation continues on our platform. Please, let's keep asking those questions. Dr. Mwila will be able to, we'll see how we can get Dr. Mwila to come back to respond to some of those questions, even on our platform via the comment section. Today's episode was brought to you by Amplify Change and the Be Safe campaign under the Youth Community Advocacy Campaign, YCAP. My name is George Mkwita. Join us next week at the same time. Remember to be safe and have a great weekend. Bye-bye.
Thank you.